Cholesterol is a type of fat the body needs to stay healthy. Our bodies make it, but we also get some from the foods we eat. Too much cholesterol in the blood can lead to buildup or plaques in the blood vessels, which can narrow them over time and cause blockages. This process is called atherosclerosis, and it increases your risk of having heart attacks and strokes. There are different types of cholesterol. Low-density lipoprotein, sometimes called LDL or bad cholesterol, is thought to be the main cause of blockages. If you have been told your cholesterol is too high, it is likely that this is the type of cholesterol that is abnormal. High cholesterol is a risk factor for developing blocked arteries. Other risk factors include older age, lack of exercise, excess body weight, smoking, high blood pressure, and diabetes. Having a family history of early heart disease or a genetic condition that causes high cholesterol also puts you at risk. People who have already had a heart attack or stroke are at very high risk. Managing risk factors, including lowering cholesterol, can reduce the risk of problems in the future. Cholesterol levels and risk factors should be evaluated at least every 5 years in those over the age of 40, and more often if needed. Your healthcare provider will determine your level of risk of having a heart attack or stroke. This may include a calculation of your risk over the next 10 years. High risk includes people that have already had a heart attack or stroke, blockages in the legs, diabetes, or certain kidney problems. Both your level of risk and cholesterol levels determine what kind of treatment you need. Those at highest risk stand to gain the greatest benefits from treatment. Your healthcare provider may discuss a target cholesterol level with you if treatment is required. In general, the lower the LDL or bad cholesterol, the better. Healthy behaviors are the key to reducing everyone's risk of heart attacks and strokes. These include quit or avoid smoking, exercise regularly, eat a balanced diet, avoid processed and fried foods, sugary drinks, and too much salt, and aim for a healthy body weight. In addition to healthy behaviors, medications may be recommended to lower your cholesterol and further reduce your risk of heart attack and stroke. Many studies have shown that statins lower the risk of having a heart attack or stroke by about 25% over 5 years. They are the most commonly used medications to lower cholesterol. The most effective statins at lowering cholesterol are atorvastatin, Lipitor, and rosuvastatin, Crestor. Other statin medications include simvastatin, pravastatin, fluvastatin, and lovastatin. Statins reduce the amount of bad cholesterol made by your body, which decreases the chances of forming plaques and blockages. They may also prevent existing plaques from worsening. Statins are generally well tolerated. The most common side effect is unexplained muscle pain or weakness. This occurs in 5 to 7 out of every 100 patients treated with statins and can appear within 4 to 6 weeks of starting a statin, with increasing the dose, or when starting an interacting medication. These symptoms may be treated by lowering the dose or trying another statin. In very rare cases, about 1 in 100,000 statin-treated patients per year, a more serious muscle problem may develop, which may include severe muscle pain. This requires immediate medical attention. If you think you may have this side effect, stop the medication and talk to your healthcare provider. Statins may also cause a small increase in blood sugars in people with diabetes or those at risk of diabetes. This often just means closer monitoring by your healthcare provider. If you do not reach your target level, or if you are unable to take a statin, you may benefit from non-statin treatments. Non-statin medications may include ezetimibe, Ezetrol, or PCSK9 inhibitors such as alirocumab, Praluent, or evolocumab, Repatha. These medications may be used alone or in combination with statins. Ezetimibe decreases the amount of cholesterol you absorb in your gut. When added to a statin, ezetimibe can lower your bad cholesterol further and has been shown to lower the risk of heart attack by a small amount in some people. PCSK9 inhibitors help the liver remove bad cholesterol from the blood. These medications are the most effective at lowering bad cholesterol levels. They have been shown to reduce the risk of heart attack and stroke in certain people. These medications are given by injection under the skin once or twice monthly and have few side effects. Treatments to lower cholesterol and prevent heart attacks and strokes should be taken lifelong. Talk to your healthcare team if you are having difficulty remembering your medications, think you are experiencing side effects, or if there are other things that prevent you from taking your medications consistently. Consult your healthcare provider before starting any new medicines, including non-prescription medicines and supplements, as they may interact with cholesterol medications. You are the most important person in any health-related decision. Education is the first step in getting the most benefit from your cholesterol-lowering medications. The more you know about your treatment, the better you can work with your healthcare team to make the right decision for you.